Knock, knock. Hi, I'm Maria. I'm going to be one of the nurses taking care of you today. I'm going to just do some quick hand hygiene. Can I have your first and last name and date of birth?
Rick James, November 27th, 1996.
Okay, perfect. I'm just going to verify that against your wristband here, and then your medical record number. Alright, and then do you know what month it is, Rick James? Is that how you, what you want to go by?
Yes.
Okay. So do you know what month it is?
November.
November? Okay. Do you know where you're at right now?
The hospital.
Okay. And then I just have another question. Do you have any allergies?
No.
Okay. So do you want to go by Rick James or just Rick? Like, how do you want me to call you?
Just Rick.
Just Rick. Alright. Gotcha. So I just want to check your IV site really quick. I just want to make sure that there's no leakage, no drainage, no swelling or redness, and there's no kinks or tubing in the line, but it looks great to me, okay? No tenderness anywhere?
Nope.
No? Okay, perfect. And then we're just going to check your hair really quick. I'm going to check your hair, your scalp, your skin, see if I see any breakdown, but I don't really see any breakdown. I'm just going to look at your tummy. Nope, no breakdown. Your nails, no breakdown. Your toenails, nope, everything looks pretty good. And you're pretty warm. Everything looks symmetrical. Your external ears, let me look on this side. Thank you. Your ears look symmetrical. I'm just going to take my light out. And I'm going to shine them in your eyes, and it's just to look to see if your pupils are equal, round, and reactive to light and accommodating. Okay, so I'm just going to look, you're going to look straight up. Thank you. And I'm going to shine it into your eyes. Perfect. Perfect. And while we're doing that, I'm going to pull this down a little bit to look into your conjunctiva and make sure that your mucous membranes are nice and pink and moist. I'm going to look into your nares. I don't see any drainage. Can you open your mouth, say ah for me?
Ah.
Perfect. Nice pink mucous membranes, no drainage. Can you smile for me? Perfect. Face is nice and symmetrical. Alright, and then are you having any trouble breathing or any chest pain?
Nope.
Okay, and I don't see any use of like accessory muscles. I don't see any extra work with breathing. I'm just going to have you sit up for me, and we're going to listen to, well, I'm going to listen to your lungs, okay?
Yep.
Alright. So I'm just putting my stethoscope on, and I'm going to listen to your lungs in a Greek key pattern. So I'm just going to move your shirt to the side here, so I can use skin-to-skin contact with my stethoscope. So stethoscope to skin contact. And then I'm going to have you take a deep breath in and out. Ready? Go. Perfect. And again. And again. And again. Again. And one more time. Are you okay?
Mm-hmm.
Okay, one more time. Perfect. Thank you for that. And then I would teach the patient how to use an incentive spirometer, and then I would have them demonstrate how to use those incentive spirometer. So the next thing we're going to do, or I'm going to do, is feel for your pulses. So I'm going to palpate your carotid pulse one side at a time. So first I'm going to do the right side, and then I'm going to do the left side, and your pulses are 2+ and palpable. And then I'm going to feel your radial pulse. First the right side, beautiful, and the left side. And then I'm going to do the same with your dorsal pedis pulses, right and left, 2+ on everything. So your pulses are great. So the next thing we're going to do, or I would do, is I would palpate the PMI at the 5th intercostal midclavicular line, intercostal space midclavicular line. And I would note that there's no lifts or heaving present. Okay? So now what I'm going to do is listen. I'm going to auscultate your carotid, and then I'll auscultate like the rest of your heart sounds as well, okay? So we're going to move on to that really quick. So I'm just going to have you scoot back a little bit. Just a little bit. Perfect. I'm going to stand, I think standing right here would be okay. And I'm going to listen to your carotid first. Listen to both sides. And I'm listening with the diaphragm and the bell. And I don't hear any bruits on either side. Okay, so the next thing I'm going to do, well, let me move this, is move on to the other locations that you have heart sounds. So first we're going to do the aortic, which is in the right sternal border, second intercostal space, okay? So that's going to be skin to skin. So we're in the right sternal border, second intercostal space. I'm listening to the aorta or aortic. Okay, and then I'm going to move on to the left sternal border, second intercostal space, to listen to the pulmonic. And then I'm going to move on to the left sternal border, third intercostal space, to listen to Erb's point. And then I'm going to move on to the tricuspid, which is the left sternal border, fourth intercostal space. And next I would auscultate the mitral area over the fifth intercostal space, midclavicular line. But for our purposes, I auscultated the other spaces. Okay, so our next exam is going to be, or part of the exam is the GI portion. So I'm going to have you lay flat. Perfect, thank you. So I'm just going to, so have you had any nausea, vomiting, or diarrhea?
Nope.
No? Do you know when your last bowel movement was?
This morning.
This morning? Okay, good. So I'm just going to move your shirt up a little bit so I can inspect your abdomen and the size, shape, symmetry. There's no pulsations, no accessory breathing as noted before. And I'm going to auscultate the bowel sounds in all four quadrants of your abdomen, okay?
Yep.
And then I just want to take note that I would listen for 5 minutes in each quadrant if no sounds were auscultated. But I am auscultating bowel sounds in all four quadrants currently, and they're all active. And then I'm going to listen right here with the bell. Okay. No bruise, no. So I'm going to touch your stomach now. I'm going to push in on your stomach first with one hand pretty lightly, and then with two hands a little deeper, okay? And I just want you to tell me if you feel any pain or tenderness, okay? Alright, and now I'm doing 2 hands. Okay, no pain or tenderness anywhere?
Nope.
Awesome. And then, have you been urinating more frequently than your usual patterns?
No.
How often do you urinate in a day on average?
4 or 5 times.
4 or 5 times? Okay. And when did you last urinate?
About an hour ago.
Alright, and then I would just monitor the intake and output of the patient, for the patient. Okay, so next I'm going to ask you about your extremities, musculoskeletal system. Are you experiencing any swelling, numbness, or tingling in any of your extremities?
Nope.
Okay, Rick, and we're going to do a hand grip test and foot pumps. So I'm going to have you squeeze my hands. Okay, and then push my hands. Oh, nope, keep holding my hands. Push them away, and then pull them towards you. Alright, strength is equal and symmetrical on both sides, no deficits noted. And then I'm going to have you sit up for me, and we're going to dangle your legs over the side of the bed. Okay, perfect. And I want you to push, okay, and pull back. Perfect. No strength deficits noted, equal and symmetrical on both sides. Okay, so the next thing we're going to do, sorry, I just wanted to adjust here, is I'm going to put the bed down in the lowest position for your safety, and then we're going to have some side rails up. The call light is right here. If you need anything, you just press this button right here, and that's going to call me, okay? It's going to send me right to you, let me know that you need something. And then, is there anything else that I can do for you?
Nope.
Alright, so I'm just going to perform some hand hygiene. You have your call light within reach, and if you need anything, you just press that call button and let me know, okay?
Thank you.
Thank you, Rick.